Hi, my name's Dr. Erica Volk and I'm a naturopathic doctor in Kelowna, British Columbia. Today I'd like to talk about thyroid and why it is that some people who are taking thyroid medication don't necessarily feel any better. So first, it's helpful to kind of look at how the thyroid functions in the first place. So the thyroid is in our throat around here, and it makes a hormone called T4 or thyroxine hormone. T4 hormone is by itself not super active. It has to be converted into another hormone called T3 hormone. This happens at the level of the cell. So your T4 goes into your circulatory system, goes to the cell. At the cell, it gets converted to T3. T3 is what actually turns that cell on, activates everything. That's what makes us feel alive and energized. So if that's not happening, then what can happen is we get a feedback loop back to the pituitary, which is another gland. And the pituitary says, thyroid's not working well enough. I'm going to tell the thyroid to work harder. And then we see what's called a TSH or thyroid stimulating hormone increase. That's what we call hypothyroidism. So this is really what I'm talking about today. I'll talk about hyperthyroidism another time, but hypothyroidism is when the cell isn't getting thyroid hormone for whatever reason, and then a message is going back to the pituitary to say we need more, and then it's screaming essentially at the thyroid to make more. So when we measure labs for thyroid, we're looking at the TSH. It's actually a pituitary marker, but because we see that level increasing, it tells us that the thyroid is having to be told to work harder than it should be working. And so we intervene, and we usually use medications for that. So the medication options are standardly, we'll start with T4 hormone, so Synthroid or levothyroxine, and that is to replace what the thyroid is making. So the thyroid should normally make T4. For many physicians, if they see that TSH increasing, they'll give the patient T4 hormone or levothyroxine. So we're just kind of supplementing this. But after what I just explained, it's possible that T4, flooding the body with T4, doesn't necessarily help it convert if the conversion is the problem. So one thing I didn't mention is that one thing that can happen is that when that T4 comes into the cell, instead of converting it to that active T3 hormone, it can actually overconvert to what we call reverse T3, which is an additional hormone that's not commonly tested for. So when we make too much reverse T3 and not enough T3, the reverse T3 will actually block the activity of T3 in the cell. So it's like something we really don't want if we want to feel better. There are a lot of reasons why we can overconvert to reverse T3, but if that's what's happening, often giving the person T4 hormone doesn't make them feel better, and it can actually make them feel worse because we're giving them too much hormone now that they can't even utilize, and so they just feel kind of overstimulated but without actually feeling energy support and all those, and improvement in their digestive system and all those other things that we really want to see. So that's one option for hormones that are usually prescribed is the T4 hormone. Another option that's prescribed is a natural desiccated thyroid hormone. So a natural desiccated thyroid hormone is a combination of T3, T4, and a little bit of T1 and T2. So 4 different hormones in one formula. And this is actually usually derived from animals. You're basically taking an animal glandular, animal thyroid essentially. So we're sort of replacing the human's thyroid with animal thyroid, but it's a more balanced formula. So sometimes people who don't tolerate Synthroid or T4 very well will do better on a natural desiccated thyroid hormone. One issue, at least in Canada, is that natural desiccated thyroid hormone is often in short supply, and so patients who are on that as a medication end up having a hard time filling their prescription when they can't find it anywhere. I'll come back to issues with this particular medication in a moment, but the third option is to do what we call, you can take just T3 hormone as well. So we call that the brand name for that one is Cytomel, or liothyronine is the generic name. And this is just active T3 hormone. So we can actually give people the active part that really revs up the cells and gets things functioning. So those are three options. And then the fourth option is to do what we call a compounded option. So this is where through a compounding pharmacy, we can make whatever we want. We can take combinations of all of those things. We can take a bit of T4, a bit of T3. We can whip up whatever we want. It's lab-made medication, so it's not from an animal. Usually we're using synthetic T3, T4, and we're making a blend of some sort in different proportions. Compounded thyroid medication is a really nice option for a lot of reasons. One is that some people react to even the fillers in their thyroid medication. drugs like Synthroid or levothyroxine or liothyronine sometimes have added things like talc, dairy products, dyes, things like that. So those things can cause symptoms in patients. The last thing we want to do is have the medication cause symptoms or aggravate other areas even as the hormones are doing their job. So a compounding pharmacy can bypass these issues by giving the active forms of the hormones, which is often a really good option, without any added fillers or dyes or anything like that. So the issue with natural desiccated thyroid hormone that I want to just touch on, because a lot of people think that natural desiccated means it's the best option because it's natural, right? And it's not made in the lab. But the problem with natural desiccated thyroid hormone is that because it's an animal glandular, for anybody who has an autoimmune thyroid process, meaning their body has antibodies that are attacking their own thyroid, taking a glandular can in some people aggravate the autoimmune activity. And the reason is that now our immune system is seeing that there's an additional foreign body in our system and will then mount additional antibodies against that. So even though it's a medication that should be helpful, it can actually exacerbate autoimmunity if the person has been diagnosed with Hashimoto's, which is an autoimmune form of thyroid issue. So that's some information about the different hormones and drug options for treating thyroid. This is just to put out there the concept that sometimes people who have been diagnosed with hypothyroidism and who are on medication but not feeling better, some of these things may be why. It's always nice to know that there are options for different medications out there, that just because you've been prescribed one and aren't feeling better, it doesn't mean you're doomed. Maybe it just means that there's an additional medication that would be a better fit for you. Having a doctor who can look deeper into the lab testing can be really helpful. So looking beyond a TSH, we can actually look at antibodies, all kinds of them. There's a bunch of different kinds of antibodies that can be active against the thyroid. We can look at what your T4 is doing, what your T3 is doing, and we can even look at a reverse T3. So all of these hormones can be a really nice way of getting a full understanding of what's happening with the thyroid and what medication is likely to be best for you. And then beyond that, sometimes with medications, unfortunately, it's a bit of a dance and we just have to figure out the right dosages. And especially when it comes down to a compounded medication, we might be doing subtle tweaks in how much T3 or how much T4 to help the person feel the best. So that's your Thyroid 101 rundown. If anyone has any questions, feel free to schedule a visit. I'm happy to help with anything thyroid related. Okay, that's it. Bye for now.